Hey guys, I want to kind of talk to you guys about weight loss, right? And why is it important to maintain and be within a normal weight? Okay, so we know that fat increases inflammation. We know that fat also increases the risk of diabetes, right? High cholesterol, hypertension, right? Metabolic issues. And usually, a person who is overweight, they're also going to have metabolic issues. So, what we see is somebody that's overweight, they're going to have a higher insulin, they're going to have a higher blood sugar. It might not be in the pre diabetic range, but they're probably going to be between 90 and 100. And I see this a lot, right? They're not yet diagnosed with prediabetes, so everything is okay. However, it's really not because the insulin is starting to rise and the blood sugar is starting to rise. And what does that mean? That means that they're on their way to developing diabetes. And what we don't want is for that to happen. Okay. So the focus of Carvalho Healthcare is to prevent disease, chronic disease, with the main focus of preventing, cardiovascular disease, which is the number one killer in America, and it's related mainly to our lifestyle, right? Lack of physical activity, a poor diet, okay, stress. We're not taking care of ourselves. We're just kind of all over the place, And the biggest thing I see that patients need is they need information, okay? So that's one of the biggest things we do is we provide that information. We try to help people understand why their weight is so important, right? We're not just trying to push, a medication. We're not just trying to push tirzepatide, semaglutide, effective weight loss medications, because as everybody knows, there's like a frenzy out there that like there's these medications that work really well and people are losing a ton of weight. The problem with that type of mentality is, yes, you're going to lose weight, but if you're not doing it in a way that is going to be effective over the long term, then you're kind of setting yourself up for issues. And the issue is going to be you're going to lose the weight, but then how are you going to maintain that weight loss, right? So what we do at Carvalho Healthcare is we are evidence based, we're science based, we're also very, common sense based, right? So what does that mean? That means like we need to focus on common sense stuff, right? So what keeps us overweight is a poor diet, okay, and a lack of physical activity. So what do we need to do? We need to eat well, and some of the times it's just like, okay, what do we need to eat? So certain foods are going to be better overall for your health. And that's going to be, vegetables, fruits, protein, all right, avoiding processed foods. Anything that comes in a package, you want to try to stay away from as much as you can. There's a few exceptions. I'm not going to get into those, but I'll say one. Oatmeal, I think, is one of them, right? It does come in a package, but it's non-processed. It's oatmeal, okay? I'm not saying that everybody needs to eat oatmeal. I'm just giving you guys an idea. Um, so the number one thing you want to do is you want to come up with a plan. If you're overweight, if you're pre-diabetic or getting there, okay, you have high cholesterol, you have fat, abdominal fat is the number one issue with weight, okay? So that's the fat you want to kind of look at, right? Is my belly getting bigger? And if it is, then you're on your way to, becoming pre-diabetic, if not already so, and then diabetic, and then you're going to have issues with cholesterol, and you might have issues with your blood pressure, okay? And then we're talking inflammatory state, right? Fat is inflammatory, too much of it, okay? We need a certain amount of fat. We don't want an excess amount of fat. So what we want is to have a certain amount of fat, but not too much. And for men and women, it's a little different, all right? Men are going to be around, 12 to 17%. Women are going to be around, 15% to like 24% body fat would be ideal for a woman. Okay. So it's a little different. Men are just, naturally they need less fat. Women need a little more. There's hormones involved. There's areas where women have more fat as opposed to men. So we're not going to villainize all fat, but we do want to look at it, and we don't want an excess amount of fat. Um, and so the biggest thing is coming, we need information. Where are we? How much fat do we really have? What is the blood work looking like? How can we help, people lose weight? And I feel like, people, patients, consumers, clients, they need information. And this is, part of what we do at Carvalho Healthcare is we try to supply that information. Because if we don't focus on preventative measures in health, we are going to fail as a healthcare system, which I would state that we are currently failing as a healthcare system, because we are just not focused on prevention, right? We're not helping people reverse disease. Unfortunately, we are, medicating issues, such as high cholesterol, high blood pressure. These things can be reverted, right, with the right information. So I hope this helps you guys. We want to, inform. We want to help people live a healthier life. That is our focus. That's our purpose here at Carvalho Healthcare. Thank you.